Knock, knock.
Hi.
Hi, how are you?
Oh, I'm well. How are you?
Good. My name's Natalie. I'm a nurse here in the clinic.
Oh, Rizwan Armstrong.
Nice to meet you, sir.
Thank you.
I'm going to just take a seat and chat with you.
Sure.
Oh, let me move my assistant.
You bet.
Hold, please. Sorry about her.
No,
I saw she got your vital signs
yeah.
and all of those things.
Yeah.
Great. So I see you're here in the clinic today to talk a little bit about you were recently admitted to the hospital last week with congestive heart failure. Is that correct?
Yes.
Tell me a little bit about the symptoms that you were experiencing that brought you into the hospital that day.
So a feeling of just kind of general unwellness, combined with shortness of breath, and I noticed swelling in my legs.
Oh, I'm sorry to hear that. Were you experiencing these symptoms for a long time, or did they just kind of come on suddenly?
They just kind of came on.
Oh, I'm sorry to hear that.
Yeah.
Were you having the shortness of breath? Was it when you were laying down, sitting up, when you were moving?
It was constant.
Just in all the time?
Yeah.
Oh, I'm sorry to hear that. I see that we got you started on some new medications while you were in the hospital.
Mm-hmm.
And I also see that you've been kind of following up with some of the providers and like the nutritionists and stuff since you've discharged. So that's all excellent. So,
yes, absolutely. It's been a lifesaver.
Good. So my job here today is to kind of talk to you a little. I'm going to do a big full assessment on you, talk to you a little bit about your congestive heart failure.
Okay.
I'm going to kind of get a picture of you as a whole. And
okay.
So I'll kind of be asking you different questions here, especially towards the end, to kind of get to know you as a person.
You bet.
Because we definitely want to make sure we're treating you as a whole person and not just parts of you. And we want to work at what's going to be best for you and for your life.
Definitely. So, okay.
So I'm going to kind of just start with just a general survey of you. And by looking at you, you look like you're doing fairly well today. Is that a correct assessment?
Yes, it is.
Excellent. I'm so glad to hear that. Have you been experiencing any anxiety, or do you feel like you're distressed at all? You don't appear to be, but
no, I'm doing okay. I'm doing
great.
Much better than I was.
Great. I'm glad to hear that. I saw when you walked into the clinic, it looked like you were walking very well. Do you feel like your gait's been fine, as in the way you walk? All of
absolutely. Yeah.
Great. So that's all been good. Another thing is talking a little bit about weights and daily weights. We weighed you when you came into the clinic today, and I know when you got discharged from the hospital, they sent you with a daily weights sheet to kind of keep track of your daily weights. Did you bring that in with you today?
I did. Absolutely.
Excellent.
Here you go.
Thank you so much. Perfect. It looks like your weight today is right on track with where you've been weighing at home, so that's great.
Thank you.
So and the daily weights are something very important to continue to do each day, because if you have a weight change of 1 to 2 pounds within like a 24 to 48 hour period, or with a weight change of 5 pounds within a week, we definitely want you to give us a call, because it could mean that your body is retaining more fluid.
I will.
And with congestive heart failure, your heart is not able to adequately pump fluid as a normal heart does. So sometimes with part of the heart isn't able to fill as quickly, so it backs up into other parts, and so that ends up backing up through the venous system and throughout the body.
Okay.
And so that's why keeping track of your daily weights is good, because sometimes you'll retain a little bit of fluid with this process.
Okay.
And so then that can back up into your lungs. It can cause you to have edema again. It can give you that sensation of being short of breath. And there's multiple other symptoms that come along with it, which we'll kind of talk about as we go through your assessment today. So, well, good. I'm glad, and your weights have been looking good. So I would just keep doing what you're doing.
Thank you.
I know the doctor started you on some Lasix, which also helps with the keeping that fluid status nice and even. If you notice that you're losing a bunch of weight unintentionally, we also want you to give us a call, because you may end up losing too much fluid through urination and things of that nature. But everything looks great for now. So moving along to kind of your neurological system, we like to just kind of get a good orientation of everybody who comes in. So can you tell me your full name?
Rizwan Armstrong.
Great. And when is your birthday, sir?
01/08/53.
Excellent. Thank you very much. Can you tell me what the current year is?
2017.
Fabulous. And what city are you in right now?
Portland.
Excellent. And can you tell me who the current president is?
Trump.
Okay, very good. You answered all my questions. Right?
Great.
Nice work. So I could tell talking to you that you seem pretty oriented, but we just want to make sure that you have a good orientation.
Sure.
Have you had any issues with confusion? Have you noticed any confusion?
No.
How about when you were having those issues with shortness of breath?
I haven't had those problems since.
Great. So when you got admitted to the hospital, though, with your shortness of breath, did you have any confusion?
Yes, I had confusion at the time, but not currently.
Good. Okay, great. And it's not uncommon. I see when you were admitted to the hospital, your oxygen saturation, so how well your body was using the oxygen, was at a low level. So you were about 84%, which that lack of oxygen can sometimes cause confusion.
Absolutely.
Because the brain
needs oxygen.
Yeah, your brain needs oxygen, exactly.
Sure.
But today you're at 96%, so that looks great.
Great.
So, and we consider kind of anything above 90, 92% really good. So that looks great.
Good.
So I'm going to test your strength now.
Sure.
Can you give my hands a big squeeze?
You bet.
Good. Those feel nice and strong. Can you hold your arms up like this for me? Great. And we're going to do the same thing on your legs. Can you hold your legs straight out for me?
Sure.
Excellent. And can you push on my hands like you're driving a car? And can you pull your toes toward your nose?
Yes.
Good. And push up on my hands. And pull down. Good. Your strength feels very good.
Yeah.
Do you feel like your strength's been good?
Yes, I do.
Good. I'm glad to hear that as well. The other thing I'm going to do is I'm going to just shine a quick light in your eye.
Okay.
And we always just like to look at pupil regularity on everybody.
Yeah.
Ready? Bright light. Bright light. Great. Thank you so much, sir.
Thank you.
Your pupils are nice and reactive and brisk, so that's very normal assessment finding there. So that's great. So next I'm going to move on to your heart, talk a little bit more about your heart. And so I'm going to first off start by taking a quick listen.
Okay.
Seeing what I hear. While I have you sitting forward and I have my stethoscope on, I'll listen to your lungs and I'll also listen to your belly as well, just as I'm there.
You bet.
Thank you so much. All right. Great. And we'll listen to your stomach real quick. Right. Thank you so much, sir.
Thank you.
Your heart sounds good.
Oh, good.
Sounds nice and normal. I saw that you, prior to coming in today, you had an EKG.
I did.
It gives you the picture of your heart and gives a little electrical impulses about your heart. Yeah. It was at a normal rate. When I just listened, you were at a normal rate. And when my assistant got your vital signs, they appeared all to be normal. Mm-hmm. So your heart rate was 88, which is well within normal range.
Okay.
I didn't hear any extra heart sounds. Sometimes with congestive heart failure, occasionally you'll hear an extra heart sound that kind of develops.
Like a murmur or a stutter?
It's just kind of with the valves. The valves don't close.
Sure.
The valves will close a little differently.
Okay.
So not necessarily a murmur, although that can happen.
Yeah.
But it's just a little extra heart sound that you may hear. Mm-hmm. But I don't hear that currently in your heart.
Oh, good, good.
So, you have it's a good normal rhythm from what I saw in your EKG. So that's great as well.
Wonderful.
I see that when you came into the hospital, you also had a chest X-ray.
I did.
They do a chest X-ray on twofold. To one, look at your lungs, but two, to also look at your heart a little bit in a sense to see how big it is. You had just some mild enlargement of your heart on that chest X-ray. And just a little bit of what we call a little bit of edema, a little pulmonary edema on it, but that has since resolved. But the size of your heart is still a little bit on the larger side, which is not uncommon in congestive heart failure to have just a little bit bigger of a heart. Mm-hmm. So that might be something that we just follow up with. If you're having no issues, we may just follow up in 6 months or so to just take another picture and see how that's looking.
Okay.
I'm going to feel your pulses real quick.
Sure.
My apologies for my cold hands. Excellent. And I'm going to feel your pulses down here.
You bet.
Great. Great. While I'm here, I'm going to just kind of feel for any edema or swelling in the legs.
Okay.
Okay, great. Thank you very much.
Oh, thank you.
Do you feel like you've been having any swelling?
No, I don't.
Good. From my assessment of what I just saw, I would say you're not really having any swelling. Everything you're not having, I see when you were admitted to the hospital, we rate kind of swelling on a number scale, and it goes from 0 to 4, and you were kind of in like a 2+ range where it was pitting, where when you push in.
And there was an indent?
Yeah, your fingerprints kind of stay in there. I'm not seeing any of that today.
Oh, good.
So that's excellent. That means that I think we may be on a good track with keeping your fluid status.
Right.
So that's excellent. Again, if you start noticing that you're starting to get some edema, definitely give us a call and let us know.
Okay, yeah, I can do that. We want
to definitely make sure we follow up on that.
Sure.
So moving from your heart to your lungs.
Okay.
You said you haven't been having any shortness of breath, is that correct?
Correct.
Have you had any issues with activity with shortness of breath?
No.
No. How about laying down?
No.
Good. I'm glad to hear all that.
Yeah.
Your lungs sound great today.
Oh, good.
Nice and clear everywhere, all throughout. Have you noticed any cough?
No.
Good. I'm glad to hear that as well. How about any shortness of breath with like extensive activity, like going upstairs or things like that?
You know, I haven't. I have stairs where I live, but I've been okay with those. Okay,
great. Sometimes activity intolerance, you'll start to notice where you get shortness of breath with activity. And that's can happen with congestive heart failure. And so again, if that starts to occur for you, please let us know.
Sure.
Because we definitely want to work with you to make sure we can do everything we can to avoid you getting to the point where you have to end up in the hospital again or feeling like you really can't breathe, because that's no fun for you.
Okay.
But yeah, your lungs are sounding good. That last x-ray that they shot looked good. All the edema that was there is gone. You have nice, good, clear lungs at this point. So that's excellent.
Good.
And like I said, your oxygen saturation looked great. Well, I forgot to tell you while we were looking at your vital signs, your blood pressure also looked great.
Thank you.
No issues there. And your whole time in the hospital, you had a little bit of lower blood pressure when you first admitted. But that seemed to resolve as you got feeling better.
It sure did. I track it at home as well.
You do?
I do.
Great. And that might be something you want to keep on your, have like another sheet of like your blood pressures if you start having some issues with lower pressure.
That's a good idea.
At this point, your blood pressure looks great.
Well, great.
So I want to also next move on to talking a little bit about your belly.
Okay.
Have you had any issues with nausea or vomiting?
No.
Good. I'm glad to hear that. How's your appetite?
My appetite is fine.
Oh, good. I'm glad. I know that you saw I see on the notes that you saw the nutritionist. Is that
I did, yes.
Perfect. And she talked to you a bit about doing fluid restriction and then a low sodium diet.
Yeah, she did.
Do you have any questions about that?
No, she was pretty detailed about my restrictions in regards to low sodium.
Good.
So
yeah,
it'll just be an adjustment.
Yeah, and it definitely is. But the importance of a low sodium diet is that sodium can really cause your body to retain fluid, which can ultimately, with your heart not pumping as effectively as it could, can ultimately cause some issues.
Dangerous. Yeah,
it can cause you to retain that fluid, which can eventually build up, and you may end up with the edema
I don't want that.
issues in your lungs.
Yeah.
So we don't want that for you. So if you have any questions along the way, don't hesitate to reach out to us. We have lots of information about, things you can eat on your low sodium diet.
Mm-hmm.
And there are lots of alternatives out there that you can kind of do to help spice things up a little bit.
Yeah.
So good. I'm glad to hear you have a good appetite. Have you bowel movements regularly?
Yeah.
Great. How often?
2 times a day, 2 or 3 times a day.
Okay. Perfect. Are they formed?
Yes.
Okay.
Yep.
Great. I listened to your belly. You have good active bowel tones, which is good.
Good.
It makes me tells me everything's kind of moving in there, which is what we like.
Yes.
I'm gonna go ahead and feel your belly.
Okay.
Have you had any issues with tenderness?
No, none.
Okay, great. And you can just relax
Oh,
while I do
okay.
this.
Sure.
Ready?
Yes.
All right. Any tenderness as I touch?
No.
Good, I'm glad. Your belly feels good.
Oh, good.
One of the things I was looking for there is a lot of the times with congestive heart failure, you can, with that backup of fluid, not only can you have it in your lower extremities, but sometimes you can get it around your midsection and in your belly. We call it ascites, which is just that fluid buildup. But you don't appear to have any of that today.
No, that's good.
So if you start noticing that your belly is getting bigger, your belly is getting firmer,
right.
Please let us know.
I will.
Because that's something that we'll want to help take care of for you.
I can do that.
So with the Lasix that you got started on, do you feel like you've had an increase in your urination?
It's been pretty normal. I would say it's been 2 or 3 to 4 times a day.
Okay.
Yeah.
About the same amount as
that's about what it.
Okay.
Yeah.
Great. Any issues with having to urinate at night?
None so far.
Good. Good. So sometimes that can happen with congestive heart failure. So I always like to kind of warn people about that.
Sure.
A lot of the times with the fluid retention, when you lay flat at night, sometimes fluid will build up and
you'll have to go pee.
You'll have to go pee.
Yeah.
So the fluid will kind of do a shifting back into the cell, or from the cells back into your vasculature, which can sometimes it will take it to the kidneys with that, and then you'll urinate it out. So sometimes people are having to get up 3 or 4 times at night.
Oh my goodness. No, I've gotten pretty lucky there.
Great. So if that starts to change, please let us know.
I will. Absolutely.
With Lasix too, it's important to, I see you're on a 1 time a day dose. Make sure you take it in the morning, because if you take it at night, you may end up having more frequent having to get up at night to urinate.
Right.
So great. Looking at your skin looks like it is doing very well. Have you noticed any issues with skin?
I have not.
Good, okay. Well, your skin all seems intact. You're warm, your skin is pink, which tells me a little bit about how you're oxygenating. If your skin starts to turn a little grayish color, we get a little bit worried that you don't have enough oxygen going in, but that all looks great. Do you have any issues with your skin you want to talk about? No,
it's been normal.
Good, I'm glad to hear that. How does your strength feel? I know being hospitalized can make you feel a little weaker.
It's returning.
Good. Able to move your muscles and everything.
Yeah.
Okay. Any muscle stiffness or soreness?
Not really. No.
Good. And how's your walking?
I take daily walks, and so far they've been good.
Good. Strength feels normal?
Yes.
Good. I'm glad to hear that. Sometimes with just congestive heart failure, you can have that extended fatigue, and you can have some musculoskeletal weakness. So that's just something to kind of keep in mind and be aware of. But it appears that you are doing very well with all of those things.
Yeah.
So I'm going to just take a look at your neck real quick.
Okay.
And then just kind of, I looked in your eyes already, but just make sure we don't have any like yellowing of anything.
Sure.
I'm going to feel, have you noticed any swelling or any distension in your veins in your neck?
What does that mean?
So you have 2 veins that run along the side of your neck, called your jugular veins.
Right.
And sometimes with congestive heart failure, as that fluid can back up in the body, sometimes it will, as it's draining from the head down into your heart, down into your heart, that backup can kind of cause the veins here to pop out because it's not able to drain.
No, I haven't had any of that.
Good, I'm glad to hear. So that's something to kind of be on the lookout for. It kind of can tell us a little bit about how your fluid status is.
I'll keep an eye out for that.
So thank you very much. Thank you. Any pain when I'm touching?
No.
Good, I'm glad to hear that. Your eyes look normal, no yellowing of those.
Oh, good.
Any issues with your ears?
No.
Good, I'm glad to hear that. Perfect. Thank you so much.
Thank you.
So that kind of concludes like my physical assessment on
Sure,
you.
sure.
But as I said earlier in our meeting, that I kind of want to get to know you a little bit more as a person.
You bet.
Because we really want to treat you for you, not as just another patient with congestive heart failure. We want to work with you to figure out what's going to work best for your life. I appreciate
that. Thank you.
So tell me a little bit about yourself. What do you do for a living?
I am a librarian.
Oh, very nice.
Mm-hmm.
What kind of books do you like to read?
Fantasy.
Oh, very good.
Yeah.
Very good. How long have you been doing that?
45 years.
Wow, excellent.
Yeah.
Long time librarian.
Yeah.
Great. Do you live here in Portland?
I do. I have
Great.
2 roommates that nice. I live with.
Excellent.
Yeah.
Do you feel like it's a good housing situation for you at this point?
I do. I definitely don't feel nervous or scared at home. I feel pretty comfortable.
Good. I'm very glad to hear that.
Yeah.
And a little bit now, kind of going into a little bit of your social habits.
Sure.
Do you drink alcohol?
I don't.
Do you smoke? I
used to, but I quit.
How long ago?
15 years.
Oh, congratulations. That's excellent.
Thank you.
Excellent for your health. Do you do any recreational drugs?
No.
Great. Do you have any children? Or are you married or anything?
And I'm not married.
That's okay. How about pets?
I have 2 dogs and a cat.
Oh, lovely.
Yeah.
What kind of dogs?
Golden retrievers.
Oh, they're the best.
They are pretty special.
They are.
Yeah.
I heard one of them barking.
Yep, that was one of my dogs.
Well, they're very sweet.
Thank you.
Yes. So tell me a little bit about, so you have, we kind of talked a little bit about anxiety.
Yeah.
But do you, in general in life, do you feel like you're anxious?
No, not really.
That's good.
Yeah.
That's good. How about any history of depression or current depression?
Not currently. And historically speaking, not really either.
Great. I'm glad to hear that. We definitely want to be here for you if you do start feeling those feelings.
Absolutely.
It's a lot to have to process and a lot to have to go through.
It is. I've known people who've gone through this, and they definitely, a lot of them struggle.
Yeah.
So.
And it can, and especially with a new diagnosis of congestive heart failure,
right, it's tough.
There's a lot of life changes you're having to take place.
My roommates help, and I kind of keep myself grounded by taking my dogs out on walks.
Good.
Yeah, just focusing on that.
Good. And that's being out in nature and doing things like that is a great way to kind of relieve anxiety.
Yes, it is. You're right.
Going out. How long are you able to go out for your walks for?
Usually about 45 minutes.
Excellent.
Yeah.
Any issues with breathing doing that?
None.
Great. I'm so glad to hear that. If you start to have issues with that, let us know, because that can happen. And we want to make sure we can keep you at that optimum level where you're able to keep functioning and walking with your dogs and going out. So.
Yeah, absolutely.
What kind of things do you like to do for fun?
I read a lot.
Excellent. As a librarian, I would expect that.
I watch movies. I like going outdoors, and I'm an amateur photographer, and I play guitar. That's about it.
Great.
Yeah.
Great. Those are all great things to keep active in.
Yeah.
So, and you don't have to answer these questions if you don't want, but we kind of like to talk a little bit about spirituality as well.
Sure.
Because for a lot of patients that really helps
bring
in a sense of well-being and calmness and coping.
Sure.
So, do you consider yourself a spiritual person?
I do not.
Do you have spiritual practices that you like to do of any sort?
I meditate.
Oh, nice.
Yeah, which is, I guess, sort of spiritual.
It is. I would very much agree. And meditation is a great way to just kind of bring yourself in and,
right.
Just focus on your inner
right.
peace and inner happiness. And
right.
Absolutely. So, And that's all, those are all great things to continue to do as, you know, as you continue to live with this, and we're absolutely here to work with you.
Thank you.
What questions do you have for me?
I think you've kind of answered everything I could think of.
Excellent. Well, the doctor will be in shortly.
Okay.
And please, again, let us know if you have any questions at all.
I will. Thank you so much.
You're welcome. It was nice meeting you, sir.
Likewise. Thank you.